Namaskar dosto, good evening friends. I am Dr. Sanjay Kalre, your friendly and familiar endocrinologist, and you are watching Dr. KK's Med Talks, talk show with Dr. Sanjay Kalra. Let's have the headlines for today. Now, ICMR INDIAB, which is funded by the ICMR, Indian Council for Medical Research, and conducted by the MDRF, Madras Diabetes Research Foundation, has found that 11.4% of adult Indians, 11.4% of adult Indians live with diabetes. That's more than 1 in 10. It's actually 1 in 9. Over the last few years, there has been a 20% increase in young people aged 14 to 25 who have type 2 diabetes. So 20% type 2 diabetes in people who are 20 years old. And now 20% to 25% of all young people who have diabetes have type 2 diabetes. So these are worrying trends. ये बहुत डरावने से ट्रेंड्स हैं जिसमें हमें एक्चुअली सोचना पड़ेगा कि आगे जाके क्या होगा. The WHO has classified the non-sugar sweetener aspartame as being possibly carcinogenic to humans and has recommended that it be consumed only within safe limits, just 40 milligram per kg. तो यहाँ पे भी गड़बड़ है. एक तरफ तो है possibly carcinogenic, then why consume it at all? And the US FDA has recently approved a new therapy for type 1 diabetes. So there is hope on the horizon. This is called Lantidra. It's made of donor pancreatic cells. And some people did not require insulin even for up to 5 years after receiving Lantidra. So much excitement going on in the diabetes arena, in the pre-diabetes arena. And we are speaking more and more about prevention of diabetes now. So let's go to our topic for today. Vitamin D in diabetes and pre-diabetes. Now, why do we need to speak about vitamin D here in diabetes? Is it so dynamic, this vitamin, that it can help us prevent diabetes and pre-diabetes? Let's find out. And let's get our expert guest today. Warm welcome. Welcome back, Dr. Banshi Saab.
Yes.
Namaskar. Now, Dr. Banshi Sabu is an eminent figure in not only Indian, but global diabetes care and management. इनका CV बहुत लंबा चौड़ा है, but if I were to say in a single sentence, there are many people who practice diabetes endocrinology in the country, but there are few people who shoulder more than their fair share of responsibility. And when it comes to carrying India's flag high across the world, when it comes to actually walking the talk, when it comes to going to the smallest village in the country to deliver diabetes care, that is Dr. Banshi Sabu for you. So the smallest, the most remote village of the country, you will find Dr. Banshi working there tirelessly, and you will find the same person, the same shoulders, carrying India's flag high at any international meeting and fighting successfully, advocating successfully for India's rights. Warm welcome, Dr. Banshi.
Thank you, Sanjay, for very warm welcome.
Sir, we are speaking of our rights. So that is rights as an Indian citizen, as an Indian living with diabetes. We also have to be aware of our responsibilities. If I'm an Indian, I automatically become high risk of having pre-diabetes or diabetes. And there is a 10%, 11% chance that I may have diabetes. There is a 20% chance I may have pre-diabetes. So when we speak of rights and responsibilities, what does that mean to you? Dr. Sabu, what are your rights and responsibilities as a healthcare provider? And what are our rights and responsibilities as a citizen of India?
So, as a right and responsibilities for a healthcare provider is to increase this awareness. What you are saying very rightly, just now you talked about the headline of ICMR INDIAB data, which is talking about 1 in 9 adult is having diabetes, and probably similar number is having pre-diabetes. And if I put there are patients or persons who are at the risk of developing diabetes, we have our own Indian diabetes risk score, and internationally also there is a risk score. And as you rightly said, that we Indian South Asians are at higher risk of developing developing diabetes or pre-diabetes. If in combined, I can say dysglycemia sort of thing, or metabolic syndrome. So first, as an healthcare provider, my responsibility is to increase this awareness about the diabetes, pre-diabetes, the status of diabetes, pre-diabetes, and it is going to create a lot of complication. So one thing which I can do is for the society that diabetes can be prevented. And how it can be prevented? Let me talk to the people that yes, you are at the risk of developing diabetes. If you are at the status of a pre-diabetes and a dysglycemic situation, you are the one who can definitely prevent your diabetes. And even now we have the data to show that those who are developing diabetes in first few years, when we are talking of early and aggressive control, there is a possibility for obese type 2 diabetes people, and some of them even for reversal or remission of diabetes. So that's my responsibility. At the healthcare provider, also our responsibility to increase the advocacy for this disease. As we are working for type 1 diabetes, we are working for preventing diabetes complication. We have moved from only glucose control to complication prevention. So for advocacy also, I think as a healthcare professional, our responsibility is there. As a general public, as a person not having diabetes or having diabetes, as we all South Asians are at higher risk of developing diabetes, our responsibility is that again, whatever the awareness is there, we should try to prevent diabetes. We should not become the number one in the world. We are the one who should say that we are diabetes care capital of the world. With the healthcare professional, we should work for that. Our responsibility is also that that we should know that early and aggressive control is going to prevent complication lifelong. We are going to have that legacy. Many of our persons with diabetes, they are not taking it very seriously. In first 10 years they don't take it seriously, they stop the medication, they are not compliant with the diet control, and once they develop complication, then they move around with the diabetologist and the tertiary care center and all those places when already you have developed the complication. So I think these are the things which we should talk about more and more. And I'm very happy today that I'm with you. I'm actually, I'm excited to share platform with very friendly and very eminent endocrinologist of our country, Sanjay Kalra, and on this show, Sanjay Kalra show. And this is one of the awareness which we are not only doing for the doctors and primary care physician. The idea of doing a online meeting is thousands of the doctors across the country. Otherwise, they are not in position to listen every time about all these new topics. They can listen, and to empower, to educate primary care physician is also responsibility of all super specialist, all specialists who are working in a tertiary care center. That is also one of the responsibility. Other than research and patients care, I think one of our important responsibilities is education. Education for the persons with diabetes, education our colleagues, primary care physician, and empowering them also.
So education and empowerment, like Dr. Sabu has said, is what we try to do through the Vitamin D Talk Show. We welcome Bimla Kapoor Madam. Dr. Ramesh Pal Singh Pawar sir is a pediatrician. He is logged in from Atlanta in USA today. It's early morning for him right now. Nitin Narula Sahab is with us. And many times when you advocate for the control of a disease, there is a criticism that you are trying to promote disease, you are trying to promote disease management. Actually, what we are trying to do is to prevent disease. So when we
Exactly.
speak of early diagnosis, early management of pre-diabetes, we are trying to prevent diabetes and then we are trying to prevent its complications. With this spirit, we welcome Dr. Banshi Sabu once again. Sir, there are many ways of preventing pre-diabetes and diabetes, but one of them is micronutrient optimization. Would you like to speak about that today? And what micronutrient do you feel is the most important when it comes to preventing diabetes, pre-diabetes, and their complications?
So today we are going to talk about the vitamin D, and that's also very important vitamin which can help us for how it can improve the beta cell function, what is the mechanism, how the insulin action can be improved with this, and how it prevents pre-diabetes condition also, and even in metabolic syndrome. And we know that India is a vitamin D deficient country. Even we have the ample sunlight, but still the vitamin D in our country is very deficient. I mean, there is a data even which is done with the doctors who are practicing medicine also. Even their vitamin D is also very deficient. So we have vitamin D deficiency, and that's also one of the important reason for pre-diabetes and them to convert into diabetes. One more important thing, we have actually malignant transformation. Internationally, the pre-diabetes condition is like 10% in a year they will transfer in that. While in India, the data had shown that almost like 30% of them are going to become within a year in a diabetic population. Similarly, the GDM people also, if they do the follow-up, the Caucasian had shown that almost 10 years for them to develop diabetes, while in India it had shown also early in their course. So we are the one who is also having malignant transformation of this pre-diabetes diabetes. One of the important micronutrient is vitamin D, which we are going to discuss today. And I think this vitamin D supplementation now had become very easy. So if we just teach and educate the mass population along with the primary care physician, because they are the one who is going to take care of these people who are not going to come to the endocrinologist or diabetologist. They will be going to their primary care physician for some small or minor elements. And there, if we are treated with these problems, and if they diagnose them with a pre-diabetes or with metabolic syndrome or with obesity, or those who are prone to develop diabetes, checking their sugar and giving them or checking their vitamin D, probably it will help them for not to get converted into diabetes population.
Sure. Sure, we'll continue with the discussion. And would you like to have a structured discussion with slides? And after that, we can have questions from the audience.
Yes, sir. Should I share the slide? Yes.
Sure. Yes.
So again, I'm once again thank you very much for IJCP, and thanks Sanjay for kind words of introduction. I'm really very excited to share the platform with Sanjay, and he had given me an opportunity, IJCP and Sanjay, that giving a talk on the role of vitamin D in a diabetes and pre-diabetes. As we were talking about the ICMR in diabetes study, and we were talking about the incidence and prevalence of diabetes in our country and pre-diabetes. It's really very high and very alarming situation that we all know. So how we can prevent and where the role of vitamin D comes, that we are going to discuss in next 20-25 minutes. This is very important slide, that association between vitamin D status and pre-diabetes. If you see the source and some of the reference which I had put here, which is talking that a persons with vitamin D, recent evidence suggests that how a serum vitamin D increase pre-diabetes risk. Even the meta-analysis and articles exploring the association found that individuals with pre-diabetes had vitamin D concentration, that they have less or lower vitamin D concentration, and pre-diabetic individuals with vitamin D deficiency are at higher risk of new onset diabetes. So this is very important, that those persons who are at lower vitamin D level, they are at higher risk of developing new onset diabetes also. And the meta-analysis also had shown a direct correlation between a pre-diabetic condition along with low vitamin D. This evidence from recent systemic review and meta-analysis conducted, including PubMed, MBase, clinical trials, database, suggests that optimal vitamin D status among individuals with pre-diabetes is linked to lower diabetes risk by 15%. So, I mean, just by keeping them at vitamin D at an optimal level, it reduces the risk by 15%. Vitamin D supplementation increases the chances of regression to normal glucose regulation among pre-diabetic population individuals by 30%. And this is very interesting. Those who have normal, they have less risk with 15%, but by supplementing vitamin D, the chances of regression to normal glucose is by 30%. So that's very, very important data. Now, the benefits of vitamin D supplementation in individuals with pre-diabetes. Very important, it improved beta cell function. Vitamin D supplementation improves beta cell function among those with baseline vitamin D level. It lowers new onset diabetes risk. The rate of incident diabetes at year 2 was markedly lower in subjects who received of vitamin D supplementation than with placebo. Now, benefits of vitamin D supplementation in Asian with pre-diabetes, and that's very interesting because we are here mainly because the South Asian are at higher risk of developing diabetes and pre-diabetes. So, individuals with darker skin tone, for instance, Asians, are predisposed to poor vitamin D status. Already, when we were discussing, I already told that we Asians and Indians are at a higher risk of vitamin D deficient. Even we have a lot of ample sunlight. Asians likely harbor greater affinity of vitamin D binding proteins. Vitamin D supplementation confers significant reduction In fasting blood glucose, 2-hour post glucose level, HbA1c, and fasting insulin levels among Asians. The HbA1c, fasting blood glucose level, and fasting insulin level indices dropped more steeply during among Asian in compared to Caucasians or Americans. So that's again important that we get the benefit of getting vitamin D supplementation more in compared to Caucasian or American. The discrepancy is likely because Asian gain higher free vitamin D level than the other races with equivalent vitamin D dose. The association with vitamin D with diabetes also there. So that pre-diabetic association I have talked. Now we are talking about the with diabetes. Vitamin D promotes pancreatic beta cell function. Vitamin D interacts with vitamin D receptor retinoic acid X receptor complex. This binds to vitamin D response element and it enhances the transcriptional activation of insulin gene and it boosts insulin synthesis. So how it helps, this mechanism is also shown. It modulates depolarization, stimulated insulin release through intracellular calcium regulation, extracellular calcium and calcium flux regulation through beta cells, and alteration in calcium flux directly influences insulin action too. Now, this is bit complex, but the same thing is in a very pictorial formation, that how vitamin D helps to get the insulin release and vitamin D helps in the insulin secretion, and this is how the insulin secretion improves with the proper vitamin D. Here you can see the vitamin D, and in the previous slide I had already talked that it interacts with vitamin D receptor, retinoic acid X receptor, that we call is VDR RXR, and this how it is here, it works, and this is improves the insulin secretion. So this is very important, that how vitamin D helps in patients with diabetes and pre-diabetes. Vitamin D also not only improving the insulin secretion and the beta cell function, but it also have the action at peripheral insulin target action. That is, vitamin D improves the insulin action too. Vitamin D directly enhances insulin sensitivity by stimulating insulin receptor suppression by peroxisome proliferative active receptor activation, that is PPRA alpha activation. It also have transcription factor stimulation that is instrumental in fatty acid metabolism regulation. It has got indirect effect through the regulation of extracellular calcium, calcium flux as well as intracellular calcium. So the vitamin D have an insulin action which helps increasing the improving the insulin action too. Association between vitamin D status and diabetes. Vitamin D deficiency impairs glucose mediated insulin secretion in vitro, in vivo studies also. Vitamin D directly affects beta cell function. Dysfunctional vitamin D receptor induces insulin biosynthesis, and vitamin D can be activated within the beta cells by CYP27 beta 1 enzyme, enabling the paracrine activity of vitamin D. So there is a role of vitamin D in pre-diabetes, role of vitamin D in diabetes, and also it has got a role of vitamin D in diabetes prevention too. The insulin sensitivity, it improves or it augments the insulin sensitivity by enhancing insulin receptor expression. Indirectly, hypovitaminosis D causes increased parathyroid hormone concentration, which heighten insulin resistance. We all know that whenever the vitamin D will be deficient, there will be hyperparathyroidism, and this hyperparathyroidism or increasing parathyroid hormone concentration actually increases insulin resistance. Vitamin D can mitigate the effects of inflammation that curbs diabetes risk. It improves insulin sensitivity. It protects against beta cell cytokinin induced apoptosis. So both the ways it helps, it improves insulin sensitivity and it helps also for beta cell cytokinin induced apoptosis. So at both the level, it helps to improve the vitamin D helps in patients with diabetes prevention, for diabetes prevention also. The high prevalence of pre-diabetes and vitamin D deficiency in women also found. So we know that with women, it is more with vitamin D deficiency, and they found to have more pre-diabetes too. There are benefits of vitamin D supplementation in type 2 diabetes prevention. A comprehensive literature review was conducted in 2020 with PubMed, MBase, and clinicaltrials.gov. Objective was to evaluate the effect of vitamin D supplementation in diabetes prevention. The findings were consistent. Association between higher serum vitamin D level lowers the new onset of diabetes risk. This result remained valid among various populations, including prediabetes and diabetes. Risk reduction in individuals with prediabetes with vitamin D supplementation had shown by 10 to 13% risk reduction. So the key takeaways with this, sorry, I'm not able to see, but it is the vitamin D which is very very important, which helps us not only for improving the beta cell function, but also in a pre-diabetic population it is found to have lowered the vitamin D and found to have more pre-diabetes. Even it has been also shown with the persons with pre-diabetes there was a lower vitamin D. By supplementing vitamin D there is a decreased incidence of pre-diabetes, and it also helps in prevention of diabetes as well as in pre-diabetes. So it's very very important vitamin which is to be taken care while in a general population. If anyone who is vitamin D deficient, by supplementing vitamin D we can definitely prevent pre-diabetes as well as diabetes, as India is a country where there is a high risk of uh, people with pre-diabetes and diabetes. With this I thank, and now again I invite Dr. Sanjay for discussion. Thank you.
Thank you, Dr. Bansi. Excellent presentation. And what we understand is that optimizing vitamin D levels are important if you have to optimize overall metabolic health.
Yes, very important.
And there is this Indian saying which means that there is light under the candle, and yet you look throughout the dark for that light, for that knowledge. Sometimes you get knowledge, you get inspiration from the simplest of uh, vitamins, the simplest of minerals, the simplest of nutrients. And we tend to ignore that for more fancy sounding treatments.
Very true.
Sir, many questions coming your way. Dr. Pawar sir has come back to India from USA, so welcome back, sir. Uh, there is a question from Nitin Narula Sahab. Suppose a patient took a lot of vitamin D, maybe took injection vitamin D every week, 4 injections, 5 injections, and then the vitamin D level goes up to 100. How much time should we wait roughly before getting it checked again? In how many weeks will it get reversed?
So first, very important thing, we consider more than 100, definitely it's a very toxic level. But normally the hypervitaminosis and toxicity is not seen so often as we expect. But one very important thing, if you find a person and his vitamin D level is high or very high, and person who has taken injectable, which is sometime taken very high dose of injectable, or sometimes some patient is, instead of taking in replacement once in a week, they start taking once in a day, and when we find that their vitamin D level are very high. So normally in condition we stop it for next 3 months, and we find that if there is no problem then we repeat it. And most of the time we see that if they are again in the range of 30 to 60, or they are in sufficient range, then they are fine. If you find them it is still high, then we again repeat it after 3 months. So this is what in normal clinical practice we do it.
That would be a very pragmatic way. And don't worry, there is no damage. Even if it does remain high for a few weeks, there is no damage on the heart or the kidneys or the lungs. Actually, it does help. There might be a little bit of constipation, but that will go away in a few days.
Very true.
Good evening to you from Anamika Anuji and Shigufta Yasmin ji. Both ask for a routine person. So I am Indian. I am at risk of pre-diabetes and diabetes. How much vitamin D should I take if I'm asymptomatic? I have not got any test done. I don't have any family history of diabetes also. I don't smoke. I am not obese. I just want to make sure that my vitamin D remains okay and
So there is
I
a
minimize
yes.
pre-diabetes.
So there is a replacement dose and there is a maintenance dose. So when you are having low vitamin D, it is advisable to take 60,000 once in a week, and that we replace it between 3 months to 4 months. And then there is a maintenance dose which is like 60,000 unit per month, and that is to be taken almost like lifelong, because we all are not going to have sufficient vitamin D by just sun exposure. So this is what is recommended. If definitely, we normally those who have insufficient vitamin D or low vitamin D, by replacing vitamin D, we try to repeat the test also after 6 months and whether they are having sufficient vitamin D in their body or not. If they are not having, then again a replacement dosing can be done to them for another 12 weeks. But otherwise, normally we keep it like after 12 to 16 weeks. If they get the sufficient vitamin D level, then there is a maintenance dose and that should be continued for them. Definitely, it does not mean only vitamin D they should remain with somebody who's with the risk of developing diabetes or a pre-diabetes. They should also simultaneously do the exercise and the other activity also should be taken care. It's not mean that only taking vitamin D and then forget about that he's not going to develop diabetes lifelong. It's not like that, because that reduction is between 10 to 15%. Still the obesity, the central obesity, the sedentary lifestyle, our carb content, our protein intake, which is less, the fiber content of diet is less. So all those things are also very, very important for someone to prevent the diabetes, and that should be our idea, that we should do everything for prevention of diabetes.
Now, supposing I am symptomatic, sir, I want to follow whatever you are telling me. I want to exercise. I want to go to the park. I want to go to the gym. Uh, I try also, but sometimes I have a pain in my legs. Other times I have a pain in my knees. My yoga instructor, my gym instructor, they ask me to climb stairs and climb down the stairs 5 times, but I get tired after one flight of stairs. Uh, my friend told me to do the bhangra because bhangra is very good exercise for proximal exercises, but my arms and my legs hurt. Then how much vitamin D should I take?
So I fully agree, because the vitamin D have those particularly have deficiency. They have all these symptoms also. So normally a persons with any symptoms of muscular as well as bony symptoms with the clinically, if you are finding that, first get the vitamin D and replace it with fully dose and try to get the full dose, and simultaneously a exercise which is not going to increase the pain or some increasing the physical activity will also help them, these persons, and it will also increase their confidence of doing all these things. Once their vitamin D status will improve, I'm sure their symptoms will also significantly decrease and they will feel very energetic. We have seen the persons with vitamin D level of 9. You just start giving them, and within 3 and 4 weeks, they start coming and they say, this, sir, something magic had happened. And some of us have felt ourselves also as a doctor, also, some of the doctors also have taken that. With the age, women particularly, I have seen with the 45, 50, when we start giving them vitamin D, and they start feeling so good that they feel that, some what you had given, some before that they were taking different type of vitamins just without asking any doctor, and as they found their vitamin D is deficiency. Similarly, the B12 deficiency also, we find that suddenly patients start feeling that they are very energetic, and then they start doing or whatever the exercise which you are asking them. Otherwise, when you are asking them to do this aerobics or going for gym or asking them for climbing the stairs and all those things, they may not do it because they are really feeling not doing it, and at the same time they have pain also.
Dr. Banchi, there is a salam for you from Kabul, Afghanistan. Dr. Noor Aga Danish sends his greetings to you.
Wow.
And Shagufta madam has a wonderful idea. So this is food for thought and also work for action for Dr. Banchi. Madam Shagufta has a suggestion. Can you please advocate with the government so that they can make vitamin D supplement obligatory along with injection tetanus toxoid in pregnant women? The government is doing so much for maternal health, and our maternal health is actually improving a lot by adding maybe 2 vitamin D capsules a month, perhaps, because you don't want to overdose also in pregnancy. Perhaps that will improve maternal and fetal outcomes. So, what is your opinion about this, sir?
So I fully agree, but this is actually, to be very frank, the endocrine society and many endocrinologists, by meeting with the gynec society and in a Foxy meeting, you must have seen there are, in last 20 years, we have talked about the vitamin D and in the general health and particularly for women also. And this was a talk in Foxy, and at least Now I can say that many of the gynecologists, they routinely supplement. We are also talking to the government hospital and the even the primary care. But yes, I fully agree that there should be more advocacy, as it is a health is in India is with the state health government. I mean, it is not with the central government. So suppose I am working in Gujarat, I have to talk to the Gujarat government to do more advocacy that this vitamin D supplementation should be given to all PHC center wherever there is a antenatal checkup, and then this should be the dosing. The only thing it requires more of a education to these PHC centers, and I am sure if we can talk to the government people that to supply vitamin D at a PHC level should not be a problem, because many of these government already supplying many of the medicines which are available, iron and vitamins B12 and all these things, but vitamin D can be given. More problem is to get checked up, because the cost of doing checking is more in and private setup is also very costly, and in government setup in some of the PSC and CSC level, vitamin D level are not checked up unless patient goes in tertiary care center where the vitamin D is checked up. So on a maintenance dose, definitely they can be given, and slightly as you have rightly said that in pregnancy they can be given two extra dose of 60,000 units, which will definitely help for these patient people even without checking them.
विनायक शर्मा जी also greets you saying good evening. अनी अग्रवाल जी पूछ रहे हैं क्या ग्लिमिप्राइड और मेटफॉर्मिन के साथ हम विटामिन डी ले सकते हैं?
इफ समवन इज डायबिटिक, ग्लिमिप्राइड एंड मेटफॉर्मिन के साथ हम विटामिन डी तो देते ही हैं, लेकिन एक चीज है, जो मेटफॉर्मिन लॉन्ग टर्म यूजर है उनको B12 डेफिशिएंसी भी होती है. So this is many of the primary care physicians, they are forgetting now. Even in American Diabetic Association had put even the guideline. Even the same thing we have done for RSD also. The long-term users of metformin, they should be given the supplementation of vitamin B12. The similarly, vitamin D deficiency we are talking, and we can give definitely along with glimepiride and metformin. There is no, but we normally give it once in a week. Vitamin D, while glimepiride and metformin is to be taken every day. Those who are person with diabetes.
So Ani, we can take vitamin D, मगर याद रखें कि vitamin B12 भी लेना है, especially if you are vegetarian or vegan. Then it is even more important that you must supplement vitamin B12 with metformin therapy. Another question from Nitin Narula ji, which is the most effective and safe gliptin? Though नितिन जी रिक्वेस्ट करेंगे that this is a talk on vitamin D. तो अगर हम ऐसे सारे टॉपिक्स लेते रहे ना, then confusion हो जाता है, गड़बड़ बहुत होती है, and the right message doesn't go. But Dr. Banshi, would you like to take this in one or two sentences?
So the gliptin, I mean, at present, when we have a cost effective, almost all gliptins are available to India and at a price which is now each Indian or every Indian can afford it. I will put it that those who have with cardiovascular outcome trial data which is safe, with linagliptin and with sitagliptin, I will say that they are better or safe because they have a cardiovascular outcome trial data in compared to the teneligliptin, which does not have any data. Even vildagliptin was found, we had used it for 15 years, but to be taken twice a day, and now it had come even in a once a day formulation also, but still it does not have the cardiovascular outcome trial. Still there are a lot of patients data is available with vildagliptin also, but at present I will put lina and sitagliptin found to be a cardiac safe also.
Thanks for that. There is one more question about vitamin D. Now we have packets which have 12 capsules. So it becomes very easy to remember. You don't forget your dose. You just buy that pack of 12. It is more economical and you can take one every week. And you can also use it as a family pack. If there are 4 adults in the family, that will last, so 4 people take it every week and that will last 3 weeks. And then you buy the next pack. So how do you encourage people to stick to their doses, to take vitamin D regularly? What are the tricks that you use in your OPD?
So, Sanjay, even whatever the tricks which we are using, I am finding many of our patients who are not taking it very regularly. So, you had explained them, we asked them to buy the 12, the packet of 12 for 3 months. They have to take it regularly. They come with that and they have taken that. No, sir, I forgot, I have not taken, because it's a once in a week. So there should be, I normally ask them, can you put a reminder? Because now every patient is having mobile and they can put a reminder. That's the best way. which I put, and we ask, normally I ask them to take every Sunday. Even suppose today they have come on a Wednesday or a Friday, still I ask them, okay, today you take, but then you take all the next dose will be like Sunday to Sunday. That will be more easy for you to remember. But like travelers like us who are traveling on every Saturday, Sunday, then we may ask them for other day. But otherwise, or some of them are doing some, Tuesdays for them is a going for a Balaji every Tuesday or something like that. That also we ask them, can you please don't forget your vitamin D. For maintenance dose, now I'm doing very clearly that like at my home also, like Tariq, ek Tariq is like vitamin D day. It's like on that day, prasad is also with vitamin D. Bhagwan ka prasad bhi us din vitamin D ka hi chadayenge. So everyone in your family member, whether you're cook, whether you're servant, whether you are there, whether your mother, father, everyone in the family will be taking the vitamin D at the dining table. So that's what I try to explain my patients, and sometimes some tricks work.
Many things you can do. You can have the first of every month, you can have every Tuesday, every Friday, every Sunday. And many times for maintenance, once people have taken their 12 tablets or 12 capsules, then we ask them to do it on a fortnightly basis.
Yeah.
So now the nice thing is that the Arabic calendar, that is also lunar, and the Vikram calendar is also lunar. So we tell them, so a
11.
routine language in my OPD would be कि हर अमावस और हर पूरन मासी पे आप
बिल्कुल,
विटामिन डी लेना ना भूलें. So don't forget it on full moon night and on no moon night. And a question for everybody who is logged in. So what is the Arabic month that is going on now? Now, actually, for the Vikram calendar, it's very easy. Sawan chal raha hai. So Sawan is the
बिल्कुल.
month that is going on right now. And the hint is that this Arabic month, it begins with Z. So let us see what the answer is from everyone. There's another question from Shaukat Hussain Saab. He says, what is the duration of vitamin D that I should take for a weekly basis? Can you just repeat that before I go to maintenance?
So duration of vitamin D every
Therapy.
week.
Yeah.
So
Duration of the
normally,
weekly therapy.
yeah, so normally 12 weeks definitely for the replacement therapy. Minimum 12 weeks we have to take. But if it is
Yes.
too low, then we may give it slightly more, maybe for 16 weeks. And then maintenance dose can be given first fortnightly, and then we give it once in a month also.
That would be the right way. There is another thing I would like to speak about, and that is normalization of medical conditions. What does normalization of medical conditions mean? Now, if you look at it from a public point of view, when you go on Twitter or on Facebook, you will find people saying that doctors are trying to medicalize normal things. We are trying to medicalize pre-diabetes. We are trying to promote disease and disease management. While actually the opposite is true. Why we speak about pre-diabetes? Because we want to prevent diabetes. And why do we want to prevent diabetes? Because we want to prevent the heart and kidney disease that occurs after that. Why are we speaking about preventive vitamin D? Because we want to improve musculoskeletal health. We want to reduce fractures. We want to reduce falls. If you reduce falls, you reduce fractures, you reduce death. See anybody in the community who is bedridden with a hip fracture, and you will know why vitamin D is important. Using vitamin D, if that can prevent pre-diabetes and diabetes, then that is the best and the simplest thing we can do for health, for society. However, actually the opposite is true. Now, supposing I have a pain in my knees, a pain in my legs, what will I do, Dr. Banchi? I will go and speak to my friend or maybe my brother or brother-in-law. Same age group, same gender, same ethnic group, same nutrition, same malnutrition. So my
Right.
brother or brother-in-law will say, "Are you have a pain in your left knee? Doesn't matter. I have a pain in my right knee." We go and talk to our friend. He says, both of you are just shouting about nothing at all. I have a pain in both my knees. I don't complain. So you end up normalizing ill health, and you end up living life in a suboptimal manner. Some of the ways to ask about vitamin D deficiency are, जब आप गुरुद्वारा साहिब जाते हैं तो आप मत्था टेक सकते हैं क्या? दीदी जब आप नमाज पढ़ती हैं तो नमाज पढ़ने में कोई दिक्कत तो नहीं आती उठने बैठने में? अभी हाल ही में रोजे रखे तो जब आप तरावी पढ़ना चाहते थे रात को तो आप तरावी पढ़ पाए या नहीं? आप मंदिर में जाके माथा टेकते हैं या आप पिलग्रिमेज पे गए तो तब आप चल पाए? वैष्णो देवी की पिलग्रिमेज पे आप चढ़ाई कर पाए या नहीं? मुश्किल तो नहीं आई? दीज आर सिंपल वेज ऑफ आस्किंग. Dr. Banshi, from your experience, when you ask these questions, what impact does that have on the patient? And does the patient think you are a good doctor or a bad doctor when you are
Oh,
asking
so
personal
whenever we
questions
ask
like
the,
that?
yes, very true. Leading question when we ask regarding the overall normal health and the other minor things which patient may not complain to the doctor, it gives really a great impact to the patient, and they feel that doctor is really taking care of their overall health. And when we try to understand all these aspects, then they feel really better, and they, once we get their investigation and treat them also rightly, and if they improve with their symptoms, they feel really very very good. So I mean, they get more faith in the doctor, and they feel that yes, doctor has rightly diagnosed them also. And for
And
them, after treating all these things, even for some of the asymptomatic problem, like suppose if you have corrected the vitamin D and then you want to give them lipid lowering agent also, which you have simultaneously given, for which they had not having any complaint, they will be compliant for that also.
that's
Otherwise
right.
they will be non-compliant for both the things.
And Shaukat Saab points out that calf muscular pain is associated with vitamin D deficiency. That is true. One of the simplest ways of looking for severe vitamin D deficiency, osteomalacia, is first of all, see if the patient can squat, get up from squatting position. And then you can check for tenderness also over the ankle, over the rib cage. When you press the bone, if there is tenderness, either it's a fracture, but if it's a fracture, the patient won't be able to walk at all. Patient is walking and doing her work reasonably okay. So if there is pain on pressing the bone above the ankle joint, that is the tibia, or on pressing the rib cage, that is usually a sign of vitamin D deficiency. It can be primary hyperparathyroidism also, but then that is very, very rare. I would say maybe 3 or 4 cases in a year. It is that rare. But it's been great having you, Dr. Bansi. So many questions. Dr. Shaukat says, yes, intercostal tenderness, that is
Yes.
also a sign of vitamin D deficiency. There is one question from Anupma Deshmukhji, if we can take that. Injection, capsule, oral liquid, tablet. Which one would you prefer? Let us do
So
injection versus the weekly ones first.
So injection is more preferred by orthopedic surgeons, which I have seen. The one of the reasons they are finding that some of the patients may be non-compliant, that they just want to give them, particularly in post-fracture status, they want to give them injectable, and just to make sure that person has taken the sufficient amount of vitamin D, because as it was written in injectable form. Many of the patient also feel very good while getting the injection, because they feel that doctors have the injection diya and some takat ka injection diya, and immediately they have the effect. But the vitamin D absorption with the tablet form is good enough, and I normally replace it because the oily injection is more painful intramuscular rather than a tablet form is much better, and that we give it on a regular basis. In Gujarat, we have the issues related to the capsule. Some of the patients have the vegetarian, the source they want to ask, then the gelatin which is there on that, they have feeling that we don't want to take it because of the source maybe non-vegetarian. So I am comfortable with giving them a vitamin D tablet.
And the technology has changed a lot. Now the oral vitamin D preparations, the technology is such that they can be absorbed with a meal, with a fatty meal, without a meal, without a fatty meal. So you don't have to worry about what time the patient is taking the tablet or the capsule. And usually the once weekly preparations are preferred. They are more economical. They are effective as well.
Good.
It's been great having you, sir, on this show, and we have learned so much about vitamin D, about pre-diabetes and diabetes, and about how they link together. We also
I
got
learn lot. I learn lot from you.
good insight from
You have
everybody
not
who
given the answer for that which starts with Jade. The Savan is you have we know what.
Zilhaj. Zilhaj.
Okay.
That is the month. It is Zilhaj. Yeah. And a few days more to go for Zilhaj.
Right.
Uh, and this suggestion from Dr. Shagufta Yasmin that vitamin D supplements should be made mandatory during pregnancy, that is something which has great public health importance.
Exactly.
And like Dr. Bansi said, we all should advocate. I think we've already begun doing it, but we should strengthen, redouble our efforts to do that. With this, sir, I'd like to thank you once again. Thank you from Nitin Narulaji as well. And Any last comments before we take your leave?
So, first of all, thanks Sanjay for having me here, and thank you IJCP Group for this. The message which I want to give, that one is that doing such activity and all this online activity on any particular subject which you are doing since last so many week, it has really a great impact, because even the physician or a doctor who is sitting in a rural area can listen the expert as well as you, and they get lot information, and they which they can use in their day-to-day clinical practice, because all of them are very clinically important relevant topic. As far as vitamin D is concerned, I can say that even we are talking since last almost 2 decades, and in last 1 decade, with so many talks related to vitamin D, and with so much publication and so many things which had come from India as well as from all over the world, still vitamin D deficiency is very very common. I mean, you get your 100 patients and you will find 90 of them are going to be the vitamin D deficient if they have not taken the replacement. So that sort of thing which we are seeing in our day-to-day clinical practice. So like it had become for endocrinologists and diabetologists, it will become routine that for each and every patient we are writing. It's like that. But I think it should be given from the primary care physician, and that requires more knowledge, more such educational seminar, and more webinar. And I think more and more on talk on vitamin D will help the people to improve their bone health as well as their muscular health also.
Like Mukeshji points out, vitamin D has to be given lifelong. It is a nutrient, it is a part of nutrition, and you have to continue giving it. So, to load up to replenish your stores once a week for about 12 weeks, after that, maybe once a fortnight for some people, but once a month forever, because
Yes.
it is an ongoing process. It is a nutrient which you need on an ongoing basis. Similarly, our continuing medical education programs, our awareness programs, they also should go on continuously. It is a continuous need that we have. We need to replenish our knowledge. We need to learn the latest. So our vitamin D talk shows will also continue to go on. With
Very.
this, sir, I'd like to thank you once again for having been with us. Shriyan is with us backstage. Shriyan, could you please show a certificate of appreciation for Dr. Sabu?
Oh, thank you.
Thank you, sir, for being with us. And
Thank you.
like I said, Dr. Sabu is one person who will find working tirelessly in the remotest of villages in the country, and also working at the international stage, trying to make us known as the healthcare capital of the world. With this, once again, thank you, sir, for being with us. Jai Hind.
Thank, thank you. Jai Hind, boss. Bye.